The Lesbian Gay Foundation exists to end homophobia and empower people for lesbian, gay and bisexual people in Manchester.
The work LGF are doing is nationally really important because they're providing ways in which we can replicate the work they're doing for every clinical commissioning group across the country.
Over 40,000 people used our services last year in one way or another. One particular campaign that was aimed at lesbian and bisexual women, which was "Are you ready for your screen test?"
The percentage of women who said that they'd been for a cervical screen went up from 49% to 73%, and we were really pleased to show that our work had that impact on people's lives.
Well, today is the rapid screening clinic.
1 in 10 gay and bisexual men in this country have HIV, and 1 in 3 of those men with HIV aren't aware they have HIV infection.
It's a safe space for them, and I don't feel like I'm going to a clinic or a hospital, which puts the fear of God into a lot of people.
We have some very good evidence that some lesbian, gay and bisexual people actually experience increased health inequalities.
It's really important that we provide services for LGBT people who are experiencing any kind of mental health problem or issues with things like substance misuse or smoking or drinking too much.
One of our key programmes of work is our Pride in Practice programme, which is a quality assurance system working with GP surgeries.
We decided to embark on the Pride in Practice Awards scheme to see how we could better the services that we were offering for our LGBT patients.
Sometimes 50% of lesbian, gay and bisexual people don't feel confident in disclosing their sexual orientation to their healthcare provider for fear of being judged, for fear of being discriminated against.
It's made the consultations easier for us and quicker for us as the GP, and also getting a lot more relevant information from the patients.
The sexual orientation monitoring is really one of our key priorities at the LGF, and the reason for that is that if you're not counted, then you don't count.
Too often sexual orientation is not asked, and that matters when it may well be that the services that you are providing are missing the needs of some of the people that most desperately need them.
So what we've been doing at the LGF is trying to work with a lot of public sector organisations to give them the support and information that they need.
They're helping the NHS, they're helping commissioners to really understand the needs of their patient populations. If we don't know about people, how on earth can we design services for them?
We developed the companion LGBT document to the Public Health Outcome Framework. It's been endorsed by Public Health England, but it also contains really helpful and useful statistics and evidence that actually supports public health local teams in every local authority across the country in actually meeting the needs of LGBT people.
It's absolutely crucial to making sure we meet the needs of the very diverse communities in Manchester, but particularly our lesbian and gay communities.
For older LGBT people, their needs can be different.
I came out in my late mid-50s. I get to close contact with LGF has been a big help.
We want to do more work working with black and ethnic minority, lesbian, gay and bisexual people. We think they're very poorly served at the moment.
One of our priorities is to reduce health inequalities. We can only do that by working in partnership with organisations such as the Lesbian and Gay Foundation.
We are here to serve you, ending homophobia, empowering people, and I'm very, very proud to lead such a passionate, committed group of people.